My dad is an immigrant here, and the father figure that they assigned him was like one of the first African American eye doctors that was in my area growing up in Youngstown, Ohio. And so I grew up in the eye shop trying the glasses on, like just being around him. And so I was like, I want to be a doctor so that I can take care of my family. I'll say the first visit, I always say part of it is like a meet and greet, right? Because I think you find the people that need to find you in the same way. So I think energies match. Most of the time I kind of set with the visit by setting expectations and the type of style that I practice of medicine. I'm very much, we create a partnership and it's like a team approach. So I tell people that I'm the GPS. And I'm like, hey, it's time to make a left. If you decide that you don't want to make the left, I'm like, there's another left in 2 miles. It might take us longer to get to where we have to go, but we will get there. To me, the first bit is very much like, what are your goals? What do you want to accomplish? And how do we get there? Most rewarding part, I would say when I'm able to see that someone is following the path and the trajectory and we get there and they're excited that I was able to like go on the journey with them. So non-judgmental, we'll do what we can. I try to give people options. So I'm like, there's no one right way to do something. We can find a bunch of different options that you like. And for me, that's really rewarding. It's like, hey, you were right. This is what we did. And I'm like, look, now you're thriving. You're doing great. My hope is that they get invested in prevention. I always say an ounce of prevention is better than a pound of cure. So I want them to know that health is a linear process and most of healthcare happens at their house and not with me. So trying to make sure that they understand that they have to put some work in, and I will always put the work in for them. They just got to make sure that it's a two-way street. I'm a little spicy and my personality is pretty big, so as long as they are prepared for a provider who is going to be walking beside them, but be very nosy, want to know their personal business, and really have like invested interest in their health outcomes.